Thank you for keeping it on Great Day SA. Peripheral artery disease affects a lot of San Antonians, but this vascular doctor that I spoke with has some helpful information and technology to help with someone's symptoms. Welcome, Dr. Jeff Martinez with Espada Vascular. It's nice to have you in studio today.
Well, thanks for having me this morning. I appreciate it.
Absolutely. This is going to be useful information for our audience. Can you just remind our audience, what does a vascular surgeon do?
So vascular surgeons have traditionally lived under this no name. People don't really know what we do. But what we do is take care of blood vessels, and it's all the blood vessels outside of the heart. So the heart and the chest are generally treated by the cardiothoracic surgeons, and all the other blood vessels belong to us.
And this is very common in our community, the cases that you see, correct?
Yes. In our community, we do have a lot of vascular disease, and that has a lot to do with the risk factors that cause vascular disease.
And what are some of those risk factors?
So the main risk factors are if you're over the age of 50, if you're a smoker, if you're a diabetic, if you have heart disease or kidney disease, high blood pressure or high cholesterol, all those are risk factors to developing PAD or blockages of the arteries or poor circulation.
Are there stages of PAD, which is known as peripheral artery disease?
Yes, there are. So the first stage is really just no symptoms at all. So you can have PAD or blockages and not really know that you have it, and it's really not of any consequence. There's never been any evidence to suggest that treating patients who have no symptoms do better than those who do have symptoms. So in general, we don't treat those patients. The next stage is called intermittent claudication, and that's really symptoms when you begin walking, and that's usually from disease that's a little bit higher up in the extremities. So the patients will experience pain with walking. That's the most classic symptom, but they can get tired legs with walking, and they can also just get fatigue in the legs and have to stop. And that's kind of the key, is that they have to stop. So that's sort of the second stage. And then after that, we have what we call rest pain or tissue loss, and that's kind of lumped into a category that we call critical limb ischemia. And those are the patients that we really focus on, because those are the ones that are at higher risk of losing their leg.
Well, thank you for clarifying what that could look like. I know that diabetes is a huge risk factor as well. How can people get more information and learn about what you do and how you can help people with diabetes as well?
So there are treatments for diabetes. There's all the new drugs that everybody's heard of. They're having great benefits with that too. But we've also become involved in a new program that's called physician-directed physiologic insulin resensitization, and that's a big mouthful of words. But basically what we are doing is we're taking insulin and using that as a form of treatment, as a hormone and not as a drug to control the diabetes. It allows the receptors on the cells to resensitize and improve the insulin sensitivity, which improves a lot of the comorbidities that are caused by the diabetes.
Okay, doctor, and does someone need to book an appointment with you to get more information on that or to learn about how you may be able to help them?
Yes, the best way is to just call our office and we can schedule an appointment. A lot of patients nowadays need referrals, but we can generally handle that through the office.
Well, thank you for being here with us today and sharing this valuable information.
Thanks for having me.